Introduction to gaming addiction. Gaming addiction, formally recognized as gaming disorder by the World Health Organization, represents a significant public health concern in the digital age. This condition involves a persistent or recurrent gaming behavior pattern that leads to significant impairment or distress. Understanding its multifaceted nature is crucial for effective intervention and support. The course will delve into the various aspects of this disorder, from its origins to its treatment. It is important to approach this topic with empathy and a commitment to evidence-based practices. Recognizing the signs and symptoms early can make a substantial difference in an individual's recovery journey. The increasing accessibility of online gaming platforms and the immersive nature of modern video games contribute to the complexity of this issue. While gaming can be a source of entertainment and social connections for many, for a subset of individuals, it can evolve into a compulsive behavior that disrupts daily life. This introductory module sets the foundation for exploring the diagnostic criteria, underlying mechanisms, and therapeutic approaches. Professionals must be equipped to differentiate between recreational gaming and problematic gaming. This diploma aims to provide that essential framework for dealing with gaming addiction effectively. Defining Gaming Disorder, DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, includes Internet Gaming Disorder, IGD, in Section 3 as a condition requiring further research. While not a formal disorder, its inclusion highlights growing clinical concern and the need for more empirical study. The proposed criteria for IGD mirror those of other addictive disorders, focusing on impaired control and negative consequences. This provisional recognition underscores the evolving understanding of behavioral addictions. It is crucial for practitioners to stay informed about these developments. The DSM-5's approach encourages a careful, research-driven path towards formal classification, ensuring robust evidence supports future diagnostic changes. The proposed diagnostic criteria for Internet gaming disorder in the DSM-5 include a preoccupation with gaming, withdrawal symptoms when gaming is stopped, tolerance, unsuccessful attempts to control gaming, loss of interest in other activities, continued excessive gaming despite knowledge of psychosocial problems, deceiving others about gaming time, using gaming to escape negative moods, and jeopardizing or losing a significant relationship or opportunity due to gaming. For a diagnosis to be considered, at least 5 of these criteria must be met within a 12-month period. This framework provides a structured approach for clinicians to assess problematic gaming behaviors. Understanding these specific criteria is fundamental for accurate identification and intervention planning. Prevalence and demographics. The prevalence of gaming addiction varies significantly across different studies and regions, largely due to different diagnostic criteria and assessment methods. Estimates typically range from 1% to 10% of the general population, with higher rates observed in specific demographics. Understanding these variations is critical for public health planning and targeted interventions. The global nature of online gaming means that prevalence rates can be influenced by cultural factors, internet access, and the availability of diverse gaming content. Longitudinal studies are continually refining these estimates, providing a clearer picture of the disorder's true scope. This ongoing research helps to inform policy and resource allocation. Demographic studies consistently indicate that gaming addiction is more prevalent among adolescents and young adults, particularly males. This demographic trend is often attributed to factors such as developmental stage, social pressures, and the marketing strategies of gaming companies. However, it is important to note that gaming addiction can affect individuals of all ages and genders. Cultural contexts also play a significant role, with some Asian countries reporting higher prevalence rates, potentially linked to societal pressures and academic expectations. Recognizing these demographic patterns allows for the development of more effective prevention programs and tailored treatment approaches. Further research is needed to fully understand the nuances of these demographic distributions. Neurobiology of addiction, general. Addiction, in its broadest sense, is a complex brain disease characterized by compulsive substance use or engagement in rewarding behaviors despite harmful consequences. It involves significant alterations in brain structure and function, particularly within the reward pathways. The mesolimbic dopamine system, often referred to as the brain's reward circuit, plays a central role. Neurotransmitters like dopamine are crucial in mediating the pleasurable effects of addictive behaviors, reinforcing their repetition. Understanding these fundamental neurobiological processes is essential for comprehending all forms of addiction. This foundational knowledge informs the development of effective treatment strategies. The brain's capacity for neuroplasticity also means that these changes are not necessarily permanent, offering hope for recovery. Chronic exposure to addictive stimuli leads to neuroadaptations, including changes in dopamine receptor sensitivity and alterations in prefrontal cortex function. The prefrontal cortex, responsible for executive functions like decision-making, impulse control, and judgment, becomes impaired, contributing to the compulsive nature of addiction. These changes can reduce an individual's ability to resist urges and make rational choices regarding their addictive behavior. Furthermore, stress and environmental cues can trigger powerful cravings through their influence on these altered neural circuits. This intricate interplay of brain regions and neurochemistry underscores why addiction is so challenging to overcome without professional help. The long-term effects on brain function highlight the need for sustained recovery efforts. Neurobiology of gaming addiction. While not involving a substance, gaming addiction shares many neurobiological characteristics with substance use disorders. Functional MRI studies have shown that individuals with gaming addiction exhibit similar patterns of brain activity in reward pathways when exposed to gaming cues. The release of dopamine during gaming, particularly during moments of achievement or novelty, reinforces the behavior, leading to a cycle of craving and engagement. These neural responses are not merely psychological, they reflect tangible changes in brain chemistry and connectivity. Understanding these parallels helps validate gaming addiction as a legitimate clinical concern. This neurobiological basis underscores the need for targeted interventions that address these underlying brain changes. Specific neuroadaptations observed in gaming addiction include altered connectivity in brain regions associated with impulse control, emotional regulation, and decision-making. The prefrontal cortex, crucial for inhibiting impulsive behaviors, may show reduced activity or connectivity, making it harder for individuals to stop gaming. Furthermore, studies suggest changes in gray matter volume in certain brain areas. Although more research is needed to fully understand their implications, these neurobiological findings provide a scientific foundation for understanding the compulsive nature of gaming addiction. They also highlight the importance of interventions that aim to restore healthy brain function and improve self-regulation. The brain's response to gaming can be profoundly impactful. Psychological factors and comorbidity. Several psychological factors can predispose individuals to developing gaming addiction. These include low self-esteem, social anxiety, depression, and attention deficit hyperactivity disorder, ADHD. Gaming can serve as an escape mechanism, offering a sense of competence, achievement, or social connection that may be lacking in real life. For individuals struggling with self-worth, virtual achievements can provide temporary validation. Social anxiety might lead to preferring online interactions over face-to-face ones, where perceived risks are lower. Understanding these underlying psychological vulnerabilities is crucial for developing comprehensive treatment plans. Addressing these co-occurring conditions is often a key component of successful recovery. Comorbidity, the presence of two or more disorders in the same individual, is highly prevalent in gaming addiction. Depression and anxiety disorders are frequently observed alongside problematic gaming, often exacerbating each other. Individuals may use gaming to self-medicate or cope with symptoms of these mental health conditions. Furthermore, substance use disorders and other behavioral addictions can co-occur, complicating diagnosis and treatment. It is essential for clinicians to conduct thorough assessments to identify all co-occurring conditions. An integrated treatment approach that addresses both gaming addiction and its comorbidities is typically more effective than treating them in isolation. This holistic perspective is vital for long-term recovery and well-being. Social and environmental risk factors. Beyond individual psychological vulnerabilities, social and environmental factors significantly contribute to the risk of developing gaming addiction. A lack of social support, family conflict, academic or work-related stress, and easy access to gaming platforms can all increase susceptibility. Peer pressure, especially in online gaming communities, can also play a role, encouraging excessive play to maintain social standing or group cohesion. The normalization of extensive gaming within certain social circles can make it difficult for individuals to recognize problematic behavior. Understanding these external influences is crucial for a holistic approach to prevention and treatment. Addressing these factors often requires systemic changes and community-level interventions. The design of video games themselves, often incorporating highly engaging and rewarding mechanics, can also be considered an environmental risk factor. Features like endless progression systems, loot boxes, competitive leaderboards, and social reinforcement through in-game communities are designed to maximize player engagement and retention. While these are not inherently harmful, they can exploit vulnerabilities in susceptible individuals. Furthermore, cultural attitudes towards gaming, parental supervision, and the availability of alternative recreational activities all shape an individual's risk profile. A comprehensive understanding of gaming addiction necessitates considering this complex interplay of individual, social, and environmental elements. This multifaceted perspective is essential for effective intervention strategies. Impact on daily life and relationships. Gaming addiction can profoundly disrupt an individual's daily life, leading to significant impairments across multiple domains. Academic performance often declines due to neglected studies, and employment may be jeopardized by decreased productivity or absenteeism. Basic self-care, such as hygiene, sleep, and nutrition, can be severely neglected as gaming takes precedence. Financial stability can also suffer, either from excessive spending on games or from job loss. These disruptions create a vicious cycle, where the negative consequences of gaming further fuel the need to escape into the virtual world. Recognizing these impacts is crucial for both the individual and their support system. Early intervention can mitigate these escalating problems. The impact of gaming addiction extends significantly to personal relationships. Family members often experience increased conflict, communication breakdowns, and feelings of neglect or frustration. Friendships can deteriorate as individuals withdraw from real-world social activities in favor of online interactions. Romantic relationships may suffer from a lack of intimacy, shared activities, and emotional presence. Trust can be eroded by deception regarding gaming habits and time spent. These relational strains can lead to isolation and further entrench the individual in their gaming behavior. Addressing these relational consequences is a vital part of the recovery process, often requiring family therapy or couples counseling. Rebuilding trust and communication is a long-term goal. Assessment tools and screening. Effective intervention for gaming addiction begins with thorough assessment and screening. Various tools have been developed to identify individuals at risk or those already experiencing problematic gaming behaviors. These tools range from self-report questionnaires to structured clinical interviews. The goal is to gather comprehensive information about the individual's gaming habits, the impact on their life, and any co-occurring mental health conditions. It is crucial to use validated and reliable instruments to ensure accurate assessment. Proper screening helps differentiate between recreational gaming and addictive patterns. This initial step is foundational for tailoring appropriate treatment plans and ensuring resources are directed effectively. Commonly used assessment tools include the Internet Gaming Disorder Test, IGDT-20, the Gaming Addiction Scale, GAS, and the Problematic Online Gaming Questionnaire, POG-Q. These instruments typically assess criteria such as preoccupation, withdrawal, tolerance, loss of control, and negative consequences. Beyond standardized questionnaires, a comprehensive assessment should also involve a clinical interview to explore the individual's history, motivations for gaming, social context, and perceived impact. Collateral information from family members, with the client's consent, can provide valuable additional perspectives. A multi-method assessment approach ensures a holistic understanding of the individual's situation. This thorough process is essential for accurate diagnosis and effective treatment planning. Diagnostic criteria and differential diagnosis. Accurate diagnosis of gaming addiction relies on a clear understanding and application of established diagnostic criteria, such as those proposed in the DSM-5 for Internet Gaming Disorder or the ICD-11 for gaming disorder. These criteria typically involve a pattern of persistent or recurrent gaming behavior characterized by impaired control over gaming, increasing priority given to gaming over other life activities, and continuation or escalation of gaming despite negative consequences. The behavior pattern must be of sufficient severity to result in significant impairment in personal, family, social, educational, occupational, or other important areas of functioning. It is crucial that the pattern of gaming is normally evident over a period of at least 12 months. Although the duration may be shorter if all diagnostic requirements are met and symptoms are severe. This structured approach ensures consistency in diagnosis. Differential diagnosis is a critical step to distinguish gaming addiction from other conditions that may present with similar symptoms or co-occur. It involves ruling out other mental health disorders, such as depression, anxiety disorders, ADHD, or obsessive-compulsive disorder, which might mimic or contribute to excessive gaming. For example, social withdrawal could be a symptom of both depression and gaming addiction. It is also important to differentiate problematic gaming from enthusiastic but non-addictive engagement. A thorough clinical evaluation, including a detailed history and mental status examination, is necessary to make an accurate differential diagnosis. Misdiagnosis can lead to ineffective treatment and prolonged suffering. Therefore, careful consideration of all potential diagnoses is paramount for effective intervention. Cognitive behavioral therapy, CBT principles. Cognitive behavioral therapy, CBT, is one of the most widely used and evidence-based therapeutic approaches for various addictions, including gaming addiction. Its core principle is that thoughts, feelings, and behaviors are interconnected. And by changing maladaptive thought patterns and behaviors, individuals can achieve healthier outcomes. CBT helps clients identify and challenge distorted cognitive biases related to gaming, such as "I can't cope without gaming" or "gaming is my only source of happiness." It also focuses on developing coping strategies to manage cravings and high-risk situations. This approach empowers individuals to take an active role in their recovery. The structured nature of CBT makes it highly adaptable to various clinical settings. Key techniques in CBT for gaming addiction include cognitive restructuring, behavioral experiments, and exposure and response prevention. Cognitive restructuring involves identifying and modifying irrational or unhelpful thoughts that perpetuate gaming behavior. Behavioral experiments help clients test their beliefs about gaming and discover alternative behaviors. Exposure and response prevention gradually exposes individuals to gaming cues while preventing them from engaging in the behavior, thereby reducing their reactivity to triggers. Additionally, CBT often incorporates skill-building components such as stress management, problem-solving, and social skills training to equip individuals with tools for long-term recovery. These techniques are designed to foster self-efficacy and sustainable change. Motivational interviewing techniques. Motivational interviewing, MI, is a client-centered counseling style for eliciting behavior change by helping clients explore and resolve ambivalence. It is particularly effective for individuals who are reluctant or ambivalent about changing their gaming habits. MI operates on the principles of expressing empathy, developing discrepancy, rolling with resistance, and supporting self-efficacy. Rather than confronting resistance directly, MI guides clients to articulate their own reasons for change, fostering intrinsic motivation. This collaborative approach respects the client's autonomy and pace of change. It is a powerful tool for preparing individuals for more intensive therapeutic interventions. MI helps clients move from contemplation to action. Key techniques in motivational interviewing include open-ended questions, affirmations, reflective listening, and summaries. OARS. Open-ended questions encourage detailed responses and exploration of feelings and thoughts. Affirmations acknowledge the client's strengths and efforts, building rapport and self-esteem. Reflective listening involves accurately paraphrasing and reflecting back what the client has said, demonstrating understanding and encouraging further elaboration. Summaries tie together multiple statements, reinforcing the client's expressed desire for change. These techniques help to evoke change talk, statements by the client that express a desire, ability, reason, or need for change. The goal is to strengthen the client's commitment to change. Mastering OARS is fundamental for effective MI practice. Family systems therapy approaches. Family systems therapy views gaming addiction not merely as an individual problem, but as a symptom of dysfunction within the broader family system. This approach posits that family members' interactions, communication patterns, and roles can either perpetuate or alleviate the addictive behavior. The focus shifts from blaming the individual to understanding the systemic dynamics that contribute to the problem. By addressing these underlying family issues, the entire system can heal, and the individual's gaming addiction can be more effectively managed. This perspective recognizes that a person's behavior is often influenced by their relational context. Engaging the family in treatment can significantly improve outcomes. Key techniques in family systems therapy for gaming addiction include genograms, boundary setting, and communication skills training. Genograms help to map out family relationships, patterns, and historical issues across generations, revealing underlying dynamics. Boundary setting involves establishing clear and healthy limits around gaming time, responsibilities, and communication within the family. Communication skills training teaches family members how to express needs, feelings, and concerns constructively, reducing conflict and fostering mutual understanding. The goal is to create a more supportive and functional family environment that promotes the individual's recovery and overall family well-being. This collaborative approach empowers families to become agents of positive change. Pharmacological interventions overview. While there are no medications specifically approved for gaming addiction, pharmacological interventions may be considered to address co-occurring mental health conditions that often accompany it. For instance, antidepressants may be prescribed for comorbid depression, anxiolytics for anxiety disorders, or stimulants for ADHD. These medications can help stabilize mood, reduce anxiety, and improve focus, thereby indirectly supporting the individual's ability to engage in therapy and manage their gaming impulses. It is crucial that any pharmacological treatment is part of a comprehensive treatment plan integrated with psychotherapy and behavioral interventions. Medication alone is rarely sufficient to treat the complex behavioral patterns of addiction. A psychiatrist or medical doctor should always oversee medication management. Research into potential pharmacological treatments directly targeting gaming addiction is ongoing. Some studies have explored the use of opioid antagonists, such as naltrexone, which are used in other behavioral addictions to reduce cravings. Other areas of investigation include mood stabilizers and glutamatergic agents. However, these are still largely experimental and not yet standard practice. Clinicians must stay informed about the latest research findings and exercise caution when considering off-label use of medications. The primary focus remains on psychotherapy and behavioral interventions, with medication serving as an adjunctive support for symptom management. Patient safety and evidence-based practice are paramount in all treatment decisions. Digital detox and behavioral strategies. Digital detox involves a period of abstinence from digital devices and online activities. including gaming, to reset habits and regain control. This strategy aims to break the compulsive cycle of gaming and allow individuals to reconnect with real-world activities and relationships. It can range from a complete temporary abstinence to a more gradual reduction in screen time. Behavioral strategies focus on developing healthier routines and alternative coping mechanisms. These interventions help individuals identify triggers, establish boundaries, and replace problematic gaming with constructive activities. The goal is not necessarily to eliminate gaming entirely, but to achieve a balanced and controlled relationship with digital media. This process requires significant commitment and support. Key behavioral strategies include setting strict time limits for gaming, creating gaming-free zones or times, engaging in alternative hobbies, and developing a structured daily schedule. Time limits can be enforced through apps or parental controls, while gaming-free zones might involve keeping devices out of bedrooms. Encouraging participation in sports, creative arts, or social clubs provides fulfilling alternatives that build self-esteem and social connections. A structured daily schedule helps to fill time previously spent gaming with productive and enjoyable activities. Furthermore, identifying and avoiding triggers, such as specific times of day or emotional states, is crucial. These strategies empower individuals to regain control over their time and attention, fostering a healthier lifestyle. Relapse prevention strategies. Relapse prevention is a critical component of treatment for gaming addiction, as it is for all addictive behaviors. It involves teaching individuals to anticipate, identify, and cope with high-risk situations and triggers that could lead to a return to problematic gaming. The goal is to develop a robust set of skills that enable long-term maintenance of recovery. Relapse is often a process, not a single event, beginning with subtle slips that can escalate if not addressed. Understanding this process allows for proactive intervention and skill building. Effective relapse prevention empowers individuals to navigate challenges and sustain their progress. It is an ongoing journey that requires vigilance and continuous self-monitoring. Key strategies for relapse prevention include identifying personal triggers, developing coping plans, strengthening support systems, and practicing mindfulness. Triggers can be internal, for example, stress, boredom, loneliness, or external, for example, seeing gaming ads, being around gaming friends. Coping plans involve specific actions to take when triggers arise, such as engaging in alternative activities, reaching out to a support person, or practicing relaxation techniques. Strengthening support systems ensures individuals have a network of people who can offer encouragement and accountability. Mindfulness helps individuals stay present and observe cravings without acting on them. Regularly reviewing and updating these strategies is essential for sustained recovery. These proactive measures build resilience against potential setbacks. Support groups and community resources. Support groups and community resources play a vital role in the recovery process for individuals dealing with gaming addiction. These resources provide a safe and understanding environment where individuals can share their experiences, receive peer support, and learn from others facing similar challenges. Groups like Gaming Addicts Anonymous, GAA, or online forums offer a sense of belonging and reduce feelings of isolation, which are common in addiction. The shared experience fosters empathy and provides practical advice from those who have navigated recovery successfully. These groups are often free or low cost, making them accessible to a wide range of individuals. They complement professional therapy by offering continuous, accessible support. Beyond formal support groups, various community resources can aid in recovery. These include local mental health services, recreational centers offering alternative activities, educational programs, and vocational training. Connecting with these resources helps individuals rebuild their lives, develop new skills, and reintegrate into society. Family support groups, such as Al-Anon for families of alcoholics, can also be adapted or specific groups created for families of individuals with gaming addiction, providing support for loved ones. Building a robust network of support, both formal and informal, is crucial for long-term sobriety and well-being. These resources collectively create a comprehensive ecosystem of care that extends beyond the therapist's office. Ethical considerations for practitioners. Practitioners working with gaming addiction face unique ethical considerations that require careful navigation. Maintaining client confidentiality is paramount, especially when dealing with minors or when collateral information from family members is involved. Informed consent must be obtained for all assessments and interventions, ensuring clients fully understand the nature of treatment and its potential risks and benefits. Competence is another key ethical principle. Practitioners must ensure they have adequate training and expertise in treating behavioral addictions, and specifically gaming addiction. Referring clients to specialists when their needs exceed the practitioner's competence is an ethical imperative. These principles guide responsible and effective practice. Dual relationships, boundaries, and cultural sensitivity are additional ethical concerns. Practitioners must avoid dual relationships that could impair objectivity or exploit clients. Establishing clear professional boundaries is essential to maintain a therapeutic environment. Given the global nature of gaming, cultural sensitivity is crucial. Practitioners must understand how cultural norms and values might influence gaming behavior and treatment engagement. Avoiding imposing Western-centric views and adapting interventions to be culturally appropriate is vital. Furthermore, practitioners have an ethical responsibility to stay updated on research and best practices in the evolving field of gaming addiction. Adherence to these ethical guidelines ensures client safety and promotes trust in the therapeutic relationship. Future trends in gaming addiction treatment. The field of gaming addiction treatment is rapidly evolving, with several promising future trends emerging. One significant trend is the increasing integration of technology into therapy itself, such as virtual reality, VR, and augmented reality, AR, for exposure therapy or skill building. Mobile health and health apps are also being developed to provide accessible support, track progress, and deliver interventions. These technological advancements offer new avenues for personalized and engaging treatment delivery. The potential for AI-driven diagnostics and personalized treatment plans based on individual neurobiological profiles is also a growing area of interest. These innovations aim to make treatment more effective and widely available. Another key trend is the greater emphasis on prevention and early intervention, particularly among at-risk youth. Educational programs in schools and public health campaigns are being developed to raise awareness about healthy gaming habits and identify problematic patterns early. Research continues to refine our understanding of the neurobiological and psychological underpinnings of gaming addiction, leading to more targeted and evidence-based interventions. Furthermore, there's a growing recognition of the need for interdisciplinary collaboration, bringing together mental health professionals, game developers, educators, and policymakers to address this complex issue comprehensively. This collaborative approach is essential for creating a supportive ecosystem for individuals and families affected by gaming addiction. Conclusion and professional development. This diploma course has provided a comprehensive overview of gaming addiction, from its definition and neurobiological underpinnings to assessment, diagnosis, and evidence-based treatment strategies. The complex interplay of psychological, social, and environmental factors underscores the need for a holistic and individualized approach to care. Practitioners are now equipped with foundational knowledge and practical skills to support individuals and families affected by problematic gaming behaviors. The journey of recovery is often challenging, but with informed and compassionate guidance, positive outcomes are achievable. Continuous learning and adaptation are essential in this evolving field. This course serves as a stepping stone for further specialization and expertise. Professional development in the field of gaming addiction is an ongoing process. Staying updated with the latest research, attending workshops, and participating in professional communities are crucial for refining skills and expanding knowledge. The landscape of digital entertainment and its associated challenges is constantly changing, requiring practitioners to remain agile and informed. pursuing advanced certifications, engaging in supervision, and contributing to research can further enhance expertise. Ultimately, the goal is to provide the highest quality of care to those struggling with gaming addiction, promoting healthier digital lives and overall well-being. This commitment to lifelong learning ensures practitioners remain at the forefront of effective intervention,